Hi, today I'm going to talk to you about how to create a presentation outline. You need to organize your ideas before you get started making slides. So first, it's a good idea to start with your mission statement for your charity. My charity is called the Noma Hope Foundation. Our mission is to prevent and treat Noma in northwestern Nigeria by providing innovative, culturally sensitive, and sustainable solutions, including mobile clinics, telemedicine, nutrition support, and oral hygiene education, to improve the health and well-being of affected children and communities. By starting with my mission statement, I can make sure that my mind is focused on what I really need in my presentation. Next, organize your information into clear sections. You've been doing a lot of research, you've got a lot of ideas, but you need to make sure that you've got categories. Here are my sections. First, background on Noma. This is going to be where all of my medical research is. Everything that I know, that I've gathered, that I've learned about the disease, how it works, and how it affects people will go here. Then my current situation in northwestern Nigeria section. This will be describing how this disease impacts people in that area. Next, my charity's approach. This is basically my solution, what I'm going to be doing, what I'm proposing. Then the expected outcomes and impact. If I follow this plan, what will happen? Then the sustainability and scalability plan. That's everything moving forward, how I foresee my charity working in the future. And a call to action. That's the part of my presentation where I tell my audience what I want from them, which in this case is donations. You should use a hierarchical structure when you're making your outline. Hierarchy means a system that organizes or ranks things, usually according to power or importance. First, you start out with your broad main point, general point. You can think about all of your other broad main points first. So, my big categories. Then underneath your broad main point, you have a subpoint with some more detail to support your subpoint. Then some more specific detail to support that. Any more details that go here, data, numbers, things like that, you can keep becoming more specific if you've got a lot of detailed information. Then your next detail point, and then your next subpoint. This is now closer to being a broad main point, and then the detail that goes under that. By using a hierarchy, you can make sure that you keep in your mind what the broad main important points are, and then keep organized where all the details belong and what they're supporting. This will also help your audience when they're listening to your presentation. You should prioritize your content. Choose the most compelling or interesting information. Each detail should support your goal, convincing someone to give you money to support your charity. Avoid unnecessary detail, but include enough detail to show your audience why your charity is important to support. You need to prove that you understand your topic well enough that people feel like they can trust you with their money. Use evidence and examples. Let's take a look at some examples here. Many children in northwestern Nigeria suffer from Noma. That's not very specific and there's no evidence provided. What about this? In some communities, more than 1 in 100 children are affected. That's much more compelling and persuasive. Malnutrition is widespread. It's very general, no evidence, no examples. But chronic malnutrition weakens children's immune systems. Northwestern Nigeria has more than 50% of children under 5 who have stunted growth. That's got the evidence to make a compelling argument. You should use your evaluation criteria. Relate it back to the criteria we discussed in the evaluation video. Here, I've got a section on feasibility, a section on cultural appropriacy, and a section on whether it's effective or not. Here, each one relates back to those criteria. The criteria show that my solutions are appropriate. Consider your audience. Your audience is potential donors, so you need to think about their needs. What's their background knowledge? Are they specialists in medicine, or are they a more general audience? What are their interests? What do you think will be interesting to them? What are their needs? What do they need to know before they can trust you with some money? And incorporate storytelling. If you include case studies, this is a good way to show human impact, the potential of your project, give emotional appeal, and increase the engagement of your audience. Telling a story about someone who's affected by your medical problem will make people pay more attention to you. Plan for visual aids. Those might include images, charts, graphs, and maps. Here's a map that shows under 5 mortality by state in Nigeria. You can see in the northwest of Nigeria, it's very high. That's much more powerful than just a statistic. And here's a bar chart that shows how child mortalities are very high in northwest Nigeria. Let's look at a weak outline versus a strong outline. Here I've got my introduction and a description of the Noma crisis in northwestern Nigeria. You can see I've got information here, but it's not really information. It's like a plan of what I want to put somewhere. So an attention-grabbing opening, this doesn't tell me what it's going to be. It just says I want one. It's like a wish list. Brief introduction of yourself and your charity, that's not giving any information. It's just saying what I'm going to put there. The problem statement, again, no information, just telling me what's going to go there. Thesis statement, same problem. The Noma crisis, I've got the same problem. I've got malnutrition, poor oral hygiene, and limited access to healthcare, but there's no details here to tell me anything about this. And prevalence and distribution of Noma, there's no information there either. This is a really weak outline. Here's a better one. Here I've got my introduction, where I've got all of this information to introduce and capture the attention of my audience. Then I've got information about the Noma crisis, here with details, statistics, and specific information. This is a much better outline. Let's look at this one. Now we've got our charity's unique approach. This is the part of my outline where I'm talking about what my solutions are. You can see I've got the 3 approaches, but I don't have any real information here. This is more like telling me where I want to put my information, but it doesn't actually contain the information. That's a weak outline. Here's a much stronger version. I've got the same 3 approaches, but here I've got all of the details of how I plan to put this into action. That's a much better outline. Now it's your turn. You know how to make a good outline for your presentation. It's time to organize all that information from your research guides and get going on planning your talk.